You're listening to Health Professional Radio with Wayne Bucklar. Today my guest is Louise Davies. Louise is the Deputy CEO of Autism SA, based in South Australia. Louise, welcome to Health Professional Radio.
Thank you, Wayne.
Now, Louise, autism is one of those words that has specific meanings in some environments, and in other environments it's often misunderstood. Can you tell us what it is that Autism SA does?
Oh, we do many things at Autism SA, and at the moment it's very interesting because we're supporting the children of South Australia as we transition to the National Disability Insurance Scheme. So we provide services in many guises through therapeutic services, occupational therapy, speech pathology. We provide diagnoses for individuals who think they may have Autism Spectrum Disorder, and that's all ages, from children right through to adults. We also provide respite services for individuals and skill building activities. We provide day option services for adults, social development groups. We provide support in schools as well on a one-to-one basis for individuals and support for teachers, so consultancy support for teachers. And we provide lots of training as well for all professionals, but particularly in schools and for families and parents.
Now, Louise, you're one of the, I don't know whether we call it the early adopters or one of the trial sites for the National Disability Insurance Scheme, as I understand it.
That's right. I think we're the first to go completely statewide, and we have taken, which is a bit of an effort, I think, and we've gone for the children's age cohort. So it should be the 0 to 14. Now that's had a little bit of a slowdown over the past year or so. So really concentrating on the under 6s at the moment, but slowly taking in that 0 to 14 cohort.
And has that been an interesting journey for you?
Oh, it's been interesting. Yes, it certainly has. The numbers have increased, I think, to the numbers that they were expected in the bilateral agreement. So the actuarial numbers were probably more accurate, as you may have expected. Almost double, I think, than were in the bipartisan agreement. And that's caused some issues, I think, in general. Look, it'll sort itself out eventually. It is a trial, and I think we all have to remember that. But undoubtedly, those parents that have got plans with the NDIS have got some great supports in place.
Oh, so generally you're an enthusiast then?
I think I will be.
Yes.
I think I will be, as the NDIS rolls out and it's really embedded properly. It's really difficult at this time for everybody. You know, when you are trying to support families and you can see that they're waiting for a plan and they haven't yet got the support they need, that's really difficult for us. But when you can see other families that have got support that they need through the NDIS, you can also see that that's great. So it's in a difficult transition phase at the moment. I can see what might happen, and that will be great. But I can also see where we're at the moment, and that's not so great, you know?
So we'll put it down as a tentative plus given teething problems.
Yeah.
Louise, many of our audience are clinicians, mainly in acute care and in aged care. As a result of them having heard you today on the radio, what's your takeaway message for them?
Well, autism is a lifelong condition. You know, it doesn't go away. It changes over time as the individual changes and grows. So, you know, those individuals with autism will maintain it throughout their life. And that's interesting because I think people may, and I think families struggle with this as well, actually, that it definitely is maintained, but skills and development and therapies and supports can really support that individual with ASD. Just simple strategies can really help somebody, particularly if they are in a hospital setting or an aged care setting. So, you know, Autism SA and other organisations like us can certainly help in those settings and help training staff in those settings if that's what's required. But there are things that can be done to support individuals with autism in whatever setting they may be.
And I have to confess, in my ignorance, it never occurred to me that autism could be an issue in aged care, but I guess if it's something that doesn't go away, it's got to end up in aged care eventually, doesn't it?
That's exactly right, and that's what we're seeing now. Of course, we focus very much on early intervention and the young age cohort, but obviously those individuals grow up, and what we're seeing now is a greater prevalence in the older age cohort, and the greatest growing prevalence of ASD diagnosis is in that adult age cohort, which have not traditionally been diagnosed. So, so that's where we're seeing that growth.
It's interesting. I'm always fascinated with my work, Louise, because I'm privileged to talk to interesting people all day, and it's always extraordinary how little I know about the world after I talk to them.
I would never call myself an expert, Wayne.
But I'm allowed to, you see. Now tell me, if not an expert, then someone who deals with misconceptions, because misconceptions are everywhere in the world. What's the biggest misconception in your work amongst your clients, customers, patients that drives you nuts and keeps you awake at night?
I think, autism is a spectrum, and so there are so many. I think what the takeaway message is that each individual with autism is unique. So when you've met one person with autism, you've met one person with autism. You can't categorise anybody with ASD. You just have to accept that everybody's unique and everybody's different. They may have some similar characteristics, but you can't say this is going to definitely work for this person. And that also goes for intervention strategies and support. You have to tailor, I think, and work with different interventions and strategies depending on the uniqueness of that individual. So I think that for me would be the thing that kind of I would say is that when you've met one person with autism, you've met one person with autism.
I think it's a great saying. In a world where we cope best when everyone fits neatly into the boxes with everyone else, it is indeed worth considering that in some circumstances we are so individual that the out-of-the-box solution just doesn't fit us.
That's right, yeah.
Louise, it's been a pleasure having a chat with you today. I do thank you for giving up your time. I realise it's a busy time for you. People who are interested in getting in touch with you, www.autismsa.org.au, is that the best way for people to get hold of you?
That's the website, and there is a website inquiry form on there, and there is also a contact us page with our phone number and all the details on there that you may require. Yep, that's the best way.
Now, if you've just missed my chat with Louise Davies, the Deputy CEO of Autism SA, the good news is we have a transcript on our website. We also have an archive on YouTube and on SoundCloud of the audio, and you can get both of those at www.hpr.fm. My name is Wayne Bucklar, and you're listening to Health Professional Radio.